Hi, I'm John Fallett with Senior Enrollment Solutions. Today we're going to discuss how to fill in the gaps of your original Medicare. Understand that your Medicare Part A has a per occurrence deductible, and then you're responsible for 20% of any and all remaining charges. Your Part B, an annual deductible, and you're responsible for 20% of any and all remaining charges. So you have two options in filling in what the government is unable or unwilling to provide to you. Your first option is to purchase a Medicare supplemental plan, oftentimes referred to as a Medigap policy. The pros of this: you can go to any doctor, you can visit any facility, any hospital, nationwide, and you're covered at or near 100%. The negatives: there is a premium in purchasing a Medicare supplemental plan. Understand that they are all standardized, providing exactly the same coverage. The only difference to you is the monthly premium that you're paying and the ratings of the insurance carrier. To run your rates, you can always visit the seniorenrollmentsolutions.com website. In regards to supplemental plans, another negative, if you will, is that you would have a standalone prescription drug plan. You would have health coverage through carrier A and prescription coverage most oftentimes through carrier B. Your other option in filling in what Medicare is unwilling to cover for you is to purchase a Medicare Advantage plan. With a Medicare Advantage plan, you're assigning your coverage to a private insurance carrier. And in turn, the government is no longer covering, if you will, your Part A and Part B of your Medicare. They're giving it to a more effective carrier to process your claims and your billing, etc. So in turn, the government then reimburses this private insurance carrier a lump sum of money to provide you coverage that's either as good as or better than your original Medicare Part A and B. So the pros: with a Medicare Advantage plan, oftentimes there is no monthly premium or a very low monthly premium because it's once again subsidized by the government. Another positive is that they include the luxuries of Medicare: your dental, vision, hearing, prescriptions, transportation, over-the-counter medications would all be included on a Medicare Advantage plan. With a Medicare Advantage plan, understand that they're just like health insurance, where you'll be limited to an HMO or a PPO network. You have to stay within that carrier's network, or if you leave, you'll be penalized or won't have coverage. And just like health insurance, they all have copayments, they all have deductibles, and they all have a risk set by the federal government not to exceed $6,700 a year in out-of-pocket consumer costs. So understand your two differences. With a Medicare supplemental plan, any doctor, any hospital, no referral requirements, near or at 100% coverage. However, you're paying a premium to have that coverage, and you're purchasing prescription drug coverage elsewhere. With a Medicare Advantage plan, no monthly premium. You get the luxuries, if you will, of what Medicare doesn't offer: dental, vision, hearing, transportation, etc. However, you're going to be bound to a network of doctors, paying copayments and deductibles along the way, possibly going up to a $6,700 potential risk. Once you make this decision, purchasing coverage is simple. If you have any other questions, visit us at seniorenrollmentsolutions.com or phone us at 877-777-5972.